Welcome back to Your Health, Your Wealth. And today I'm going to talk about precision medicine or personalized medicine. When we dive into precision medicine or personalized medicine, the reason why I chose to get into this is in this new era, new age of healthcare with AI technology, wearables, the amount of research that's going into healthcare right now. Healthcare is moving more towards this whole notion of precision or personalized medicine. And I think this is going to have a big impact on the medical economic era, as well as personal health and personal finances, because we're moving away from kind of this shotgun approach to healthcare and medicine to a much more streamlined healthcare approach and tailoring treatment specifically for the patient. So we'll dive into personalized medicine, and I'll try to break it down in a way that's understandable. I remember years ago in training when we had a chair at Baylor, and when he first came in, he introduced this notion of personalized medicine, and it was somewhat foreign to us because historically, healthcare has been about kind of sticking with the norms. You go on the research and you plan your treatment based on what the research shows. But now, years later, this whole thing of personalized medicine or precision medicine has truly come to fruition. And it's only going to get better, particularly as we start using technologies such as artificial intelligence to tailor research, as well as look at things to tailor treatment for different people. First of all, let's get into just the basics so that we can all level set on what it means when we hear this term of precision medicine or personalized medicine. But personalized medicine is this approach where you're really using information. You're using data, things like a person's genes or gene pool. You're using family history. You're using medical history. You're using lifestyle. You're using environment. And when you have the technology to be able to put all of this data together in a program or a system that can help you better tailor, whether it be a treatment or a medication that's best fit for that patient. So the doctors aren't just saying, what disease does this patient have? But now they're asking, what kind of person is this patient? Biologically, medically, and how can I find the best treatment that best fits for this patient? So it's not just treating the disease, but we're moving into this era where now we're really truly treating the patient and figuring out the best route to go when treating them. So very important shift, I think, in healthcare. And it's going to make an impact on healthcare economics as well, because we can eliminate a lot of waste if we do use more personalized medicine. So when we think about like traditional medicine and medicine that's practiced today and has been practiced for years, is based on averages. It's based on percentages. There may be a trial and it says a certain percentage respond to this treatment. And if it's above a certain threshold, then we say, okay, that's the standard of care. That's what we want to do. But when we use this average-based approach, we often miss too many people, and we don't really know if there are other options that may be better tailored for that particular person. So that's where personalized medicine comes in. It tries to close or bridge that gap between the averages or the data-driven medicine that we're practicing now and the more personalized, person-centered medicine that we see and that can be effective. One big example is, of course, medications. You may have one or two treatments that could be an option, and this medication may work very well for this patient, but then you try it in another patient and it doesn't. And you have to wonder why. Well, the statistics or the data shows that it should, But there are a lot of other factors. There are genetic factors. There are different enzymes in our body that break down medications differently. So some patients may be higher in that enzyme than others. As we use now AI, as we use more personalized labs, and we're now taking healthcare more outside of just traditional healthcare centers and more into the homes. Now we can collect that data and use that data to try to find the right treatment or the right medications. And I use some forms of precision medicine, every day when I'm in clinic. It's talking with patients. It's looking at their medical history. It's looking at their family history. I don't use as much genomics, but as that becomes easier and more easily acceptable, we'll be able to use that as well. But you take something like multiple sclerosis, where before there were like 4 medications for MS. Now there are over 30 different medications that you can use in treating a patient with multiple sclerosis. So you have to take into account that person's lifestyle, their history. Do they want, or are they okay with having an infusion? Would they prefer a pill? You take all of these things into account now to more personalize that treatment for them. And when you do that, you get increased adherence, meaning that they usually, will take their treatment, and you can potentially have less side effects, less complications and problems, because you've taken that time now to take other factors and incorporate into the treatment of that patient. Yeah, when I think about personalized medicine or precision medicine, why does it matter? And what type of impact is it going to make? The thing about what we do know about our healthcare system now is that it's become extensive, it's become expensive, and it can be very stressful to navigate. Medications have become more and more expensive. The amount of research that we're putting into finding these medications have increased the price tag of the drugs. And so it's almost like you can't afford to fail. You can't afford to fail medications anymore. So if we can use technology and if we can use artificial intelligence to make things more precise, then we can reduce waste in healthcare. There's certain principles, like even insurance companies have what's called a fail first policy, where before I can get a medication approved for a patient, they have to fail several other medications. So let's just think about that for a minute. If you take a condition like migraine headaches, which can be disabling and, cause people to miss work and miss productive time with their families, I'm literally telling that patient that even though I think that this medication A is the right medication for you and would work best in this situation, it would probably get you better faster. An insurer can come back and say, before I allow you to put this patient on medication A, which you think in your clinical experience is going to make this patient better, faster, and get them back to work or get them back to their family as soon as possible. Before I'll let you do that, you have to try medication B or C, and they have to fail that treatment. Well, what is a failing? What does it mean to fail a treatment? Well, that means that you try it for a number of weeks or a month or whatever, and they'll continue to do bad. So that whole notion of fail first, to me, just is not the best route to go in healthcare. So then how can we use personalized medicine? How can we use precision medicine to figure out ahead of time and to give data? When I say that this patient needs to be on medication A, well, I have the data to back that up, whether it be through genomics, whether it be through genetics, or anything else, to make sure that that's the right treatment. And we can skip this, whether it be weeks or months of failing other medications, and just go to what's best for that patient. Another real world example of where we're really seeing this is cancer treatments as well. Cancers have a genetic component to it. There's specific gene markers that we know about, and every patient with the same type of cancer may react differently to the treatments that are chosen. So if we can use the exact biology of the tumor or the cancer along with the patient's biology and genetics, we can help to match the right treatment for that patient. And with cancer, you don't want to waste a lot of time. The example I gave about headaches and migraines and fail first, well, you don't want to take a lot of chances when it comes to cancer. So we have this emerging field of pharmacogenetics, which you're looking, as the word says, you're looking at pharmacy, you're looking at treatments and genetics and studying the effects of different medications to different people with different genetic profiles. So personalized medicine is going to help with things like cancer treatment, also chronic disease management, taking things into account like diabetes and high blood pressure and asthma, some of these chronic conditions. Can we use all that data to create the best treatment strategy for a patient based on that? So what's driving this and what's really helping us to be able to make this transition into this new age of healthcare and medicine, of precision medicine, personalized medicine? The digital health era is really helping with that as well. There's a lot of data that we're getting from things like wearables, home monitoring devices, mobile health aids, these things that can track your sleep, that can track your activity level, your heart rate, your blood glucose. When you go in to see your doctor in a doctor's visit, that doctor gets a snapshot of what's going on. They get a specific, and they're depending largely on the history that you're providing them between the time of your last visit and this visit to really plug in or fill in the gaps in that overlap or in that treatment. But if we have the opportunity through digital health, through collecting this data to put it together, and now rather than just getting a snapshot and a history, now I have a continuous story of how this person has been doing. How have they been responding to their medications? I was a part of AI training with MIT, and I was fascinated at some of the things that they're doing there when it comes to digital health and these so-called invisible wearables where, I got my Apple Watch on, I got my Oura Ring, I use a lot of wearables to give me data, but they have technologies now where they have wearables not wearables, but they have monitoring devices that can be in the wall or, on the shelf looking like a picture or something like that. But it's continuously monitoring for certain health conditions. So, for instance, if you have a patient with Parkinson's disease, which is a disease that causes tremor and walking difficulties, and, the medications for Parkinson's disease, you sometimes have to give 3-4 times a day. And you never know when the medications are wearing off, and you have to kind of make judgments based on that. Well, if I have continuous data throughout the day of, for instance, when a patient is slowing down, like they're active at a certain part of the day, then all of a sudden they're sitting in a chair for a long period of time, or I can watch their walking pattern throughout the house and I can see when their walking becomes more shuffled. This is all the type of data that you can get from some of these wearables and even these invisible wearables. So you take that data and then you put it in, you look at it in conjunction with the medications you're giving them and what time. and you can adjust what time they take the medication. You can maybe increase the dosages. And that's what I mean by personalized medicine, by precision medicine. We're making or tailoring that person's treatment to make it more precise for them. So we're getting away from this, one size fits all model to really looking at each patient. Now it does take time. It's going to take a mind shift in healthcare, and certainly for busy practitioners and providers. I'm not saying that it's going to be easily adapted or accepted, because some people will say, "Hey, you know, eh, I just don't have more time to devote toward looking at each patient, going through this data." And that's where things like AI programs and technologies can come in to help us to be able to put this data together and put it in a form or a fashion to be able to now personalize or make this treatment or this treatment regimen more personalized and more precise for the patient. We all know that at the center of healthcare is the patient. And so from the patient's point of view, or the consumer's point of view, the first benefit that I highlight is just a better treatment match. When you can tailor treatment, you don't have to go through this fail first method where you're failing a number of treatments to get to the one that's right for that person. We can use this data, we can use the information to figure out the best treatment for them without having to go through a bunch of failed medications, which one could be expensive for the patient, can be expensive and timely for the healthcare system. Especially, let's say you have a condition that's serious, where if you have exacerbations or worsenings like MS, like myasthenia gravis, like NMO, you end up in the hospital, you end up in the ICU, which is tens of thousands a day. So if I can save that money in healthcare by making a treatment that's more precise, then that's helping you as a patient, and keeping you and your condition from getting worse. Secondly, there are fewer side effects. If I know more about your genetics, if I know more about different things that I know will affect, like side effects from medications, then we can prevent that. We can choose treatment, we can choose medications, or go to another medication and we can avoid those side effects. And side effects can be deadly at times, but they lead to more morbidity, mortality, decreased productivity. So if we can avoid side effects, then that's what we want to do. And that's definitely a benefit to the patient as well. Precision medicine will allow us to get to our decisions faster. I can't speak enough about how things have changed, where before, even if I make a diagnosis, I would have to give people this spiel about, hey, okay, just because we made this diagnosis, it's going to take several months to figure out what's the right treatment for you, or we may have to try this first, then try something else, see how this works. Well, now, in this new age of healthcare, hopefully I'll be able to use tools and data to now say, well, we can avoid that time period that we need to try this or try that, and just go to what best works for you. So it allows us to make faster decisions and also more confident decisions. We're as I mentioned earlier, we're getting away from this trial and error of healthcare, and now being able to be more personalized, and that feels good. That feels empowering as a clinician, because if I am going to be paternalistic and tell you, okay, I think this is what's best for you, or you should be on this, well, now I have the data to prove it, and I can explain why, based on all of these different factors, your lifestyle, your genetics, and everything else, why this is the best for you. So it helps with shared decision making, because we're not just trying things. We are being more tailored and more specific for you and for your condition. So when I look at this whole field of precision medicine, The benefits are to both the patient and the physician. If someone knows that they're at high risk of certain disease, they may be motivated to change habits, stay on top of their screening, and follow medical advice. So it even gets into this whole notion of preventative medicine. If I have healthcare data from wearables or from different things like that, particularly about this person, I can say, hey, according to this information that I'm getting, your blood sugar, for instance, is starting to creep up to the point where, we may be looking at prediabetes or diabetes soon. So now we're in that preventative mode where that patient, he or she, can start taking or making those lifestyle changes to help to prevent from getting to that point. Well, think about how much that's saving that person from medications, um, potential problems when it comes to diabetes or heart attack or stroke or different things like that, just because we've been able to take this data and place this patient on a preventative plan to say that if we start implementing these things now, we can avoid these things in the long run. So preventative medicine is huge, and in my view, is one of the ways in which we can really reduce healthcare costs by spending more time, effort, and energy in preventative medicine. And precision medicine is one way of doing that, by using this information and figuring out ways in which we can tell patients or put them on a plan beforehand to hopefully avoid some of these long-term, complicated, and costly chronic diseases. Now, nothing is perfect. And of course, when we talk about precision medicine, there are some nuances or different things or some challenges that we have to think about. One big challenge is access. If you want to go down this route, you have to give up a certain amount of access. That may be, access to personal information like your sleep patterns through wearables. It's access to your genetic information through lab tests and so forth. There is a degree of access that you have to be open to giving up this information so that that information can be used. So this gets into privacy issues, and the more data that healthcare uses, especially when we talk about genetics, digital health data, the more important it becomes to protect that information and make sure that we're using it responsibly and ethical. What is my responsibility to society? Should my genetics be made available so that researchers can use it to help other people? These are all the ethical questions that deal with privacy that we have to take into account. The whole field of precision medicine has historically been seen as for a select few, meaning there's some fairness and representation issues. Certainly in underserved community, they may not have access to a lot of the wearables or different things that we use for precision health. So we have to make sure that we use this technology and that we make this fair and do it in a way that all people can benefit, regardless of your socioeconomic status, race, and so forth. And as we move more and more towards getting that data, then I think we'll certainly be able to make this information and make this more applicable to all populations. And so there'll be less of this fairness or underrepresentation within digital data and healthcare. So we have to be careful. We don't want to overpromise, but I am excited about where we're going with this whole notion of precision medicine. Now, there are, in today's world, there are a lot who abuse this, and there are a lot of gimmicks and different things that, whether it be through apps or tools or different things that promise like that you can live forever, and let us look at your genetics and put you on a plan. So, we want to be realistic with this, and we still want to approach precision medicine and personalized medicine, from a scientific standpoint, and make sure that it is legit and that we're not over promising, or that we're not selling people snake oil. Um, but as a healthcare community, if we work together and putting together, collecting this data, I do think there is a lot of promise moving forward. So healthcare, precision medicine, or personalized medicine is moving healthcare in a different direction. It's taking information that we all have, things like our genes, our environment, our lifestyle, and it's helping to guide both patients and healthcare providers towards making smarter decisions, quicker decisions, and decisions with less, side effects. If we can tailor those treatments, if we can tailor those medications directly to the patients, there's also a big opportunity here in preventative health. If we can use this information to help prevent a person from getting into trouble, from getting one of those chronic diseases that we know greatly increases healthcare costs through some of these chronic conditions like diabetes, high blood pressure, and so forth. So there are a lot of benefits both on the early stages as well as the treatment stages with personalized or precision medicine. There are certain things we have to look out for. We spoke about those. Privacy, we don't want to overpromise, and we want to make sure that we're using this data in a responsible way to benefit everyone, to make sure it's fair and equitable, and that everyone is represented within this data. In summary, I think healthcare is becoming more personal. And if we can work through these challenges, we can create a healthcare system where we're connecting people, where we're thinking outside of the box, and we're connecting health with this precision data to match and find a better match between the treatment, what a person needs, and what will minimize us as a healthcare industry causing more problems through side effects. We can reduce wasted dollars and unnecessary treatments or failed treatments, and ultimately lead to better outcomes. So I hope you've learned a little bit more about precision or personalized medicine. Thank you for listening to this episode of Your Health, Your Wealth. And be wise and really pay attention to this whole notion of precision medicine and how it can better impact you and your health and wealth journey. So I'm your host, Eddie Patton, and tune in for future episodes, and be sure to share this with your friends and family. And we'll see you next time for Your Health, Your Wealth.